Hi, I'm Dr. Peter Osborne. I'm the Clinical Director of Town Center Wellness, one of the country's most successful functional medicine practices. And over the past 10 years, I've had the great fortune of working with thousands of patients and helping them restore their health using the principles of functional medicine. In this video, I'm going to teach you how, one, you can implement functional medicine in your practice and increase your practice revenue and improve your patient outcomes. And if you fill out the email box below, I'm also going to give you a 70-minute presentation that I was paid to teach a group of doctors on 4 valuable lessons. The first, how to create a 6-figure income, and in some cases multiple 6-figure income, by implementing a nutritional pharmacy in your practice. 2, how to get patients from the internet using social media tools like Facebook and Twitter. 3, how to market and brand your practice using the internet. And 4, how to create a passive income stream using all those things I just mentioned so that you have to work less hours and you can reach just as many people and help just as many people. So again, if you put your email in the box below, you'll get access to that 70-minute presentation. But now I want to teach you about a very, very foundational principle in functional medicine that I call core influence. When a new patient comes into the office, they've most likely been to multiple specialists, multiple doctors, had multiple therapies, medications, possibly surgeries done, and all of those things were to a large degree unsuccessful for them. That's why they're in your office. They're looking for an alternative. And so they found you most likely because you are an alternative practitioner. You are practicing functional medicine. If you explain to your patients what your philosophy is up front, you're going to have a much, much higher rate of compliance. And what's crucial in functional medicine, because a lot of the things that we do as practitioners and doctors, a lot of the things that we do is not paid by insurance, we have to educate our patient. If we educate our patient, they're going to be much more apt to come out of pocket to pay for the things that you know that they need, but they may be hesitant to pay for because they don't quite understand what the benefit is going to be. So core influence is the tool that I use to initially educate that patient about what my philosophy is and how we're going to approach their health. So core influence goes like this. In this diagram, what we're looking at is we're looking at something called the triangle of health. And the triangle of health is just that. It's a triangle. There are 3 sides. At the center of the triangle, we have our DNA. And the DNA is at the center because we cannot change or alter the DNA at its core. In essence, we're born with what we're born with. Now, we can affect the DNA. There are epigenetic effects that can come about on the DNA. So, in essence, our environment can influence the DNA in such a way that it is positive or negative. And so there are 3 principal foundations in the environment that we have to consider. And so these 3 principles, or these 3 elements, are mental, chemical, and physical. So we'll start with mental. Mental refers to the spirituality of a patient and the psychological surroundings of a patient. So for example, if you have a patient that is obviously distraught and has gone through a lot of stress, emotional stress, maybe they're unhappy with their job, maybe they're unhappy in their marriage, maybe they've lost a loved one, these are the mental elements that can influence the health of your patient. In essence, the mental component influences the DNA. And so it creates an epigenetic effect on the DNA, okay? And I don't tell patients epigenetic because most of them don't understand that term. So what we say is the mental aspects can influence how certain genes are turned off or on. Some of these genes have a negative outcome on your DNA, and some of them have a positive outcome on your DNA. And our goal is to try to incorporate or try to create a mental stability that has a positive influence on the DNA. The next part of this diagram is the physical part, and the physical basically refers to the analogy square tires don't roll. In essence, in physiology, structure dictates function, so the shape of something will dictate how it works. Physical, in essence, is whether or not a person is overweight, whether or not they have joint dysfunction, whether or not they have muscular atrophy, whether or not they have scoliosis. So there are a lot of physical aberrations that can occur or that can be present that can influence, again, the DNA. For example, if we don't exercise, we can turn on certain genes that are more cancer promoting or that promote diabetes. If we don't exercise, we can turn on genes that promote Alzheimer's disease. So there are a number of ways in which physical attributes can influence the DNA in a negative fashion, and that would lead to a poor patient expression of disease. Additionally, we have the chemical side of the equation, and biochemistry is what we're referring to. And chemistry is basically two things. It's things that come into the body that affect us in a negative way, or things that come into the body that affect us in a positive way. So, for example, pollution in the water, pollution in the air would be two influences that have a negative overall impact on the DNA. For example, if we take in elements of certain types of xenoestrogens, which are chemicals found in petroleum, so if you live in a major city and you've got a lot of exposure to these petroleum-based chemicals, these chemicals can actually upregulate certain genes and create a number of different hormonal disruptions. So this is a way that we can identify with our patients. And in essence, the reason I explain this is because we in our office test for a lot of chemical allergens. I use a test where we measure more than 300 different food-based reactions and 300 different chemical-based reactions. So while we're looking for these reactions, we want to know what things in the environment are influencing this patient's chemistry in a negative way. So in essence, the chemistry has to do with chemicals that are having a negative impact or positive impact. And so negative would be things like pollution, would be things like certain types of plastic-based chemicals or petroleum-based chemicals, mercury, arsenic, things in the environment they could get a hold of through breathing, through eating, etc. But then you also have positive influences, and positive influence of chemistry has to do with vitamins, it has to do with minerals, and it has to do with the core elements. That's why we call this core influence, the core elements of nutrition, which are carbohydrates, fats, proteins, water, nucleic acids, vitamins, and minerals. And then we can go one step further and say that sunshine is a nutrient. We could add that to this element as well. So chemistry has to do with the patient's environmental chemistry, what the patient is surrounded with in their environment that is influencing the chemistry in a positive or negative way. So this allows me, explaining this allows me then to implement certain clinical strategies and allows the patient to understand why I'm implementing these certain clinical strategies. So, for example, if vitamins and minerals are a major influence over chemistry, then that now allows me to recommend vitamin and mineral analysis testing. So now we can do a lab workup that focuses on identifying vitamin and mineral deficiencies. But additionally, we said that in this chemical reaction we have food and environmental allergens, so now we can also look at doing labs that would analyze for chemical reactions, allergic reactions to either foods or to environmental components that patients are being exposed to. So now here we have explained all three sides of this core influence triangle, but there's one more element that needs to be explained. The mental component affects the physical component affects the chemical component, and the chemical component affects the mental component, and vice versa. We can draw arrows going both ways. By the time patients get to your office as a functional medicine doctor, most of them have had somebody address chemistry. But the problem is, the way that that chemistry was addressed is most likely an artificial chemistry. In essence, they've been put on different medications. And so, when we give medications, we are artificially affecting chemistry, and so we're only going to get a short-term benefit covering symptoms. Now, there are exceptions to this rule. For example, if somebody has a bacterial infection and we give an antibiotic, well, that's acceptable because we're actually treating the cause, we're not treating a symptom. But an example of treating the cause or the symptom would be treating somebody with high blood pressure with a diuretic. We're actually artificially manipulating the chemistry so that we can bring about a reduction of a symptom that's manifesting, that's increasing that patient's risk of developing a disease. So in essence, most patients, again, have only experienced chemistry through artificial means. Now, if they've had surgery, it's possible that they've had some of their physical aberrations addressed via surgery. So if they've had hip replacements or joint replacements, or if they've had rods put in their back due to scoliosis or a number of other things. So these are the two major ways that patients come to you. They've had this core influenced by artificial medication or by surgery. So if those things have failed, this allows you then to explain to your patient what needs to happen now, because if those methods fail, we have to go to the core influence concept. And the core influence concept says that if we identify aberrations or abnormalities in these three key areas, and we implement a treatment program based on those abnormalities, we're going to have much greater success in getting them healthy than if we just tried to treat their symptoms with nutritional supplements, or if we just tried to treat their symptoms with medications or surgery. So, in essence, again, identifying chemical problems, vitamin and mineral deficiencies, food allergies, food intolerances, environmental toxins, environmental overloads, environmental burdens, etc. We can identify infection using stool analysis. We can do a number of different functional medicine outcomes-based tests, lab tests, that would help us to identify problems in the patient's chemistry, and then we can implement treatment programs based on that core data, that information. We can also do genetic SNP testing to identify whether or not a patient is good at metabolizing vitamin B, vitamin 12, vitamin B6, folic acid. There are a number of different available now genetic single nucleotide polymorphism or genetic SNP tests that can help us to identify the risk of a patient's chemical abnormalities as well. We can address and identify mental problems and refer them out to the right type of practitioner if that's warranted or needed. Or we can do things like neurotransmitter testing that allow us to identify the potential chemical imbalances that are contributing to the mental dysfunction. And then in addition, with physical, we can take x-rays of a patient to identify any type of joint arthritis, any type of abnormalities like scoliosis. We can do a physical examination. We can do body fat analysis. So there are a number of tools that we can use through our physical exam to identify physical problems. And then we can implement a strategy. In my office, we have exercise strategies that we implement. We have different things in our office where we'll actually do rehabilitation with patients. We have a boot camp in our office where we can actually send our patients out to have them have supervised and monitored exercise. So there's a number of treatment adaptabilities here that you can implement in your office, but you first have to explain this concept to your patients so that they are going to be more prone to accept the treatment. In essence, the biggest barrier you're going to run into is, I don't want to spend money because my insurance doesn't cover it, or I don't want to come out of pocket, because some of these tests can get kind of expensive and some of these treatment options can get kind of expensive. If you explain it to your patient, you'll increase your compliance by at least 75%. In my office, we run about a 92% compliance rate. So when a new patient comes in, we explain these concepts to them so that they understand why we're going to order the tests that we're going to order, why we're going to do the procedures that I'm recommending. So now that they have an understanding of it, they feel more like they're part of their care and not more like somebody's just bossing them around and telling them what to do, and just hoping that they're going to see a result. So the patient becomes proactively part of the care. So if you implement just this one learning tool in all of your new patients coming in to see you for functional medicine, you're going to get a dramatic increase in your patient compliance. And when your patient compliance increases, so too do your patient outcomes. The patients get healthier, they feel better. And what happens to a patient when they feel better? They give you testimonies, but they also refer other patients. So you create a word-of-mouth practice based on a core influence concept that allows you to practice in a way that is enjoyable, that is meaningful, that isn't just treating symptoms, but is actually applying the elements of and the foundational elements of functional medicine to address the root cause of the disease as opposed to addressing the symptoms. So I hope you found this video and this explanation valuable. And again, if you fill out the email form just below the video here, you're going to get access to my 70-minute presentation on how you can grow a nutritional pharmacy in your office to make multiple six figures, how you can get patients on the internet using social media, how you can market and brand yourself on the internet and generate large volumes of inquiries into your office, and how you can generate a passive income stream using the internet and some of those marketing tools that are available that are free in your office, and work a lot less hours. So we'll see you on the other side. put your name or put your email in the box below, and have a great day.